Why have an ocular surface disease assessment? If you have done the basic treatment, that is omega-3s, hot compresses, lid cleaning, and ocular lubrication, and are still having symptoms, the next step is to do a more in-depth check and have some scientific numbers to help us determine the best mode of treatment. Similar to having your blood pressure checked or your blood sugar checked, your family physician will want to know what the initial readings are, and if they put you on medications, how is it affecting it? In dry eye, we want some data, such as osmolarity, tear breakup time, how many meibomian glands remain functioning, and the quality of the oil. How much water is in your lacrimal gland? How well is it secreting it? Is there inflammation present? These are some of the numbers we basically need. MSP only covers a small amount of a dry eye assessment. The remaining costs will be on the patient. What is done in a dry eye assessment? We look at the eyelids and the tears in more detail than a routine eye exam. We generally start off with the dry eye questionnaire, specifically the Canadian Dry Eye Assessment, to give us a number on your symptoms. Then we measure non-invasive tear breakup time with the topographer. This gives us an idea how long your tears are keeping their integrity or how often you need to blink to see clearly. Next, reflective mescometry is done again with the topographer, which is a measure of the size of the curvature of the lower tear meniscus, which gives us an approximation of the tear volume sac. Next, osmolarity is taken. That is a measurement of how concentrated your tears are. The higher the number, the greater the concentration, the drier your eyes are. This is done with an eye pen. A normal reading is 275 to 290. Abnormal is anything above 300, or if the difference between the eyes is greater than 8. Osmolarity is very slow to change. This is done about every 6 months to a year. The next we test is inflammatory. Inflammatory is the first and only rapid test that detects elevated levels of MMP9, an inflammatory marker that is consistently elevated in tears of patients with dry eye disease. Using direct sampling microfiltration technology, inflammatory accurately identifies elevated levels of MMP9 in tear fluid samples taken from inside lining of the lower eyelid. Simply, it tells us if inflammation is present in 10 minutes. Next is checking your lacrimal gland. How much water are you producing? Instead of the old painful Schirmer's test, we use a new pain-free SM tube test that measures in 5 seconds the eye tear volume. Readings under 5 is abnormal and 5 or above is normal. Then we go to the slit lamp and we look at the standard tear breakup time. We instill a small amount of sodium fluorescein to the lower eyelid and we measure how well the tears keep their integrity. A reading of 10 or higher is normal and under is abnormal. Then we have a good look at how well you blink, how elastic your lids are, and we look for any biofilm and scurf on the eyelid margins. Then we image the meibomian glands, and we assess the quantity of the meibomian glands. Meibomian gland expression is done to determine the quality of oil secreted and how the glands are functioning. Imaging is one thing, but how it works is another. A hot pack is placed on your closed eyes for 10 minutes. Then the eye is numbed with alkane eye drops. A stainless steel forceps that is especially designed for your gland expression is inserted around the eyelid. The tweezers are tapered so it's impossible to apply too much pressure. It cannot pinch the lid. It is important to get all the poor quality oil out. The eye is rinsed and an antibiotic is instilled. There is a small risk for a secondary eye infection. That's why the antibiotic is applied. We make note of how many glands are functioning. Once a gland is gone, it cannot return. Some patients may need to have this done every 3 to 6 months. Keeping the glands clear keeps the gland functioning and dry eye symptoms away. Then for all the measurements, we determine the best line of treatment. The dry eye assessment generally takes 45 minutes to an hour. Your eyes will be mildly red and lids slightly achy for the day following the expression. 24 hours later, you will start feeling better. Plan your day accordingly. Do not wear eye makeup for this procedure.